Call for Care is a telephone-based service manned by clinical assessors who have access to a wide directory of services. One case that particularly sticks in my mind happened during a very busy morning surgery. I was rung by a paramedic crew who were very concerned about a patient with atrial fibrillation with low blood pressure. Call for Care came out, monitored the lady's blood pressure, they adjusted the doses of the medication, and I'm sure this avoided a hospital admission.
Yes, I've used it on occasion where we visited an elderly lady. The original call came through as shortness of breath. When we got there, she'd got herself quite anxious, and that really was the problem, nothing else medical. Contacted the service, were very helpful, and told us that they'd be able to visit later on that day just to make sure that she was okay.
The GP has a request to perform a home visit for a patient. The family are concerned that the patient is deteriorating. GP goes to see the patient at home and realises that the patient doesn't need to be in hospital. There's no medical reason to admit the patient, but the patient does need some care wrapping around them to avoid an acute hospital admission. The first person he will speak to will be a call handler in the call streaming centre, who will establish that the patient is registered with a mid-knots GP and that there is an urgent need, as a subacute need, to avoid a hospital admission that requires a 2-hour response. Once the GP has clarified that that is the case, the GP is then transferred through to a clinical assessor. Once the recommendations have been agreed and a plan of action has been put into place, that call will be terminated and the clinical assessment team will take the patient on. The clinical assessor will record this assessment on System 1 using their template within the Call for Care unit, which is then shared across healthcare systems. They will also utilise the directory of service to establish if there are other services outside of that provided by the initial Call for Care response that would benefit this patient in the longer term. The GP will be able to leave the patient safe in the knowledge that they will receive a response within the next 2 hours to keep them safe at home. This response will usually be either an assistant community practitioner or a senior nurse in the form of a clinical assessor or somebody from the local integrated care team. In order to tie all of this process together, the responders will feed back to the original triaging assessor, who will then send off the appropriate electronic referrals to signpost the patient on for further care. A task will also be sent back to the referring GP to inform them of the outcome of the referral.